Thank you for joining me today for this edition of the Part A POE Teatime Bite-Sized Learning on Busy Days. This video is a basic overview of billing for federally qualified health centers, or FQHCs. Before jumping into some basic FQHC billing, I want to first talk to you about some program basics. It is important to understand what an FQHC encounter consists of. An FQHC encounter is defined as a medically necessary face-to-face or one-on-one interaction between the patient and a core practitioner for which FQHC services are performed. Encounters with multiple practitioners on the same day are considered to be one encounter, and therefore only one FQHC prospective payment system payment could be made on a given day. And the services provided are provided by or incident to, in some cases, with an FQHC practitioner. The FQHC practitioners include a physician, such as an MD or a DO, where covered professional services, including diagnosis, therapy, surgery, consultation, commonly furnished in a doctor's office. Incident to type services could include drugs and biologicals that are not self-administered, supplies, and auxiliary personnel. Nurse practitioners, physician's assistants, and certified nurse midwife are also considered to be core practitioners, and they are providing services that would be covered by physician under general medical supervision if state law requires, including, again, diagnosis, therapy, consultation services, supplies incident to a nurse practitioner, PA, or CNM that are commonly furnished in a physician's office. CP, CSW, MFT, and MHC services are mental health services commonly performed in a clinical psychologist's office. An MFT or an MHC is defined as an individual who possesses a master's or a doctor's degree, is licensed or certified by the state in which they furnish services, and who has performed at least 2 years or 3,000 hours of clinical supervised experience and meets other requirements as the Secretary determines appropriate. For the most part, FQHCs can only receive one FQHC PPS payment per day, regardless of the number of practitioners seen and regardless for the reason. Only one FQHC PPS payment can be made per day. However, there are some exceptions to this rule. After the initial encounter, the patient suffers another injury or illness that requires that they are seen again that leads to an additional diagnosis or treatment. Then in this situation, 2 FQHC PPS payments may be made. The other exception is when the patient has received a medical encounter as well as a mental health encounter on the same day. This could also generate 2 FQHC PPS payments on a given day. Certain services are not considered to be FQHC services because they are either not included in the FQHC benefit or they are not a Medicare benefit, which is also referred to as a Medicare exclusion. As I mentioned, FQHC services must be a one-on-one, and it's typically face-to-face. So therefore, group information or group therapy or medical activities, this does not meet that definition, and therefore they are not considered to be FQHC services. Also, certain services that are covered under Part B that are not FQHC services include things like, and this is not an all-inclusive list, by the way, but some of them include the EKG, EEG, or ECG. In this instance, you can report the technical component of the service to your Part B MAC on the CMS 1500 claim form or the electronic equivalent. Laboratory services are also non-FQHC services and should never be reported on an FQHC bill type. They can, however, be billed separately to the Part B MAC on a CMS 1500 claim form or the electronic equivalent. Durable medical equipment, ambulance services, prosthetic devices, and body braces are also non-FQHC services and would never be included on an FQHC bill type, but rather billed to either Part B or DME as an example for things like prosthetics and body braces, but those would not be included on an FQHC claim. And then also the technical component of diagnostic tests. Those can also be billed separately to Part B on a 1500 claim form. Now, keep in mind things like the interpretation of that diagnostic test or the interpretation of a laboratory service or EKG is an example. Those would all be included and bundled into the FQHC prospective payment system for that professional component. The technical component of these, however, can be billed to Part B. Continuing on with non-FQHC services, and tagging on to the technical component of services, there are certain preventative services for which there is a technical component. The first one could be a pap smear or screening pelvic exam. Now, this preventative service is a qualifying visit for which you would receive an FQHC PPS payment for the professional piece of that exam. However, the technical component could be billed separately to Part B. Same with prostate cancer screening, colorectal cancer screenings, screening mammographies, bone mass measurements, glaucoma screenings, and so on. So it's important to understand that certain non-FQHC services that are non-FQHC services, I should say, are covered under Part B, but they're not reported on the FQHC claim type. You would bill these to your Part B MAC under the appropriate CMS 1500 claim form or electronic equivalent. And again, just as a reminder, if you have enrolled as a DME supplier, certain orthotics, prosthetics, and body devices could be billed to DME. But you want to ensure that you are enrolled in Part B and or DME, and you have established this before billing these services to them. All right, let's jump into some basic FQHC billing. First of all, as an FQHC, your bill type when you are billing for an FQHC facility claim is submitted on a UB04 or the electronic equivalent. This is for the facility services. Okay, so that's the reason why they are billed on an institutional bill type, a claim type. And as an FQHC, your bill type is a 77X. The X represents the third position of your bill type. More often than not, you are going to be billing a 771 bill type, which is just your from and through date. It's also referred to as admit through discharge. However, if your claim has denied or rejected, or perhaps you are billing a no-pay claim to Medicare in order to receive a denial from Medicare to bill to another insurance company that may cover certain services, then your bill type would be a 770. And then if you are adjusting a claim, your bill type is a 777, and a cancel claim, if you're canceling your claim, it would be a 778 bill type. You always want to include the dates of service on your claim. units of one, as well as charges. For each line item service, you must report charges. Even for services that are considered to be incident to services, for which you are not receiving a separate payment on your claim for that incident to service, meaning that it is bundled into your FQHC PPS payment, you still must report charges for every line on your claim. You will also need to report the appropriate FQHC revenue codes. So this slide indicates all of the FQHC revenue codes. The one that you are more likely than not billing is a revenue code of a 521. That is your clinic encounter. We also have the third position of this revenue code for different instances. So for example, a home encounter, which yes, a physician can provide home services to a patient. They can make a house call. And when that occurs, they're not in your clinic, so you can bill a 522 revenue code. If your physician is going to a skilled nursing facility or a residential facility, it's important to note if they are in a Part A skilled nursing facility stay or not. If they are in a Part A skilled nursing facility stay, and this might be information you might need to gather from the facility, you would bill a 524 revenue code. If they are merely a resident of that nursing facility, then you would bill a 525, meaning that the patient is not in a Part A stay. The 527 is for visiting nurse services at a beneficiary's home when the patient is in a home health shortage area. And 528 is for non-FQHC sites, such as a scene of an accident. The 519 revenue code is for the supplemental Medicare Advantage organization payment. Now, this would only be reported if you have set this up with our audit and reimbursement department, for which you can receive the supplemental Medicare Advantage payment. This is also referred to as a Medicare Advantage wraparound payment. And then finally, the 900 revenue code is for mental health services that are provided by the CP, CSW, MFT, or MHC, for which mental health qualifying visit services are provided. Now, along with your FQHC G codes and qualifying visits, it is also important to report all services that were provided during that encounter. These are considered to be incident to services for which the payment is bundled into the FQHC PPS payment. You will report these incident to services under the appropriate revenue code, and all valid revenue codes may be used with the exception of those that you see here on this slide. So what this means is you will not bill a claim with your incident to services where all lines are reported under the revenue code 521. Incident to services should be reported under a valid revenue code and HCPCS codes or CPT code, units of service, and charges. And all valid revenue codes are used except those that you see here on the slide. And just as I look at this, one that is sticking out to me is the revenue code 080X through 088X. These are revenue codes that are reported for laboratory services. And if you remember, I said earlier, laboratory services are not included on your FQHC claim. They are billed separately to the Part B MAC. Therefore, we would never see, or we should never see, a line item on your FQHC bill that starts with the 080X revenue code and a laboratory CPT or HCPCS code. Now, FQHCs also need to report the appropriate FQHC encounter under the FQHC G code. And these are your FQHC G codes. You have G0466, which is for a medical encounter for a new patient. G0467 is for an established patient. If the patient is receiving the IPPE or the annual wellness visit, you would report that under G0468. And then G0469 and G0470 are for mental health encounters, and you would indicate whether they are a new patient or an established patient. You will report them again with the appropriate revenue code. So once again, for a medical encounter, for G0466 through G0468, you are reporting those under revenue code 52X. And then your mental health encounters are reported under revenue code 900 for G0469 and G0470. And then once again, the 519 is for the Medicare Advantage supplemental wraparound payment. You also must report charges, and you are responsible for setting the charge for each of your payment G codes. Your reimbursement is generated based on the average of rates charged for a typical bundle of service as determined by your facility. Meaning CMS, the Centers for Medicare and Medicaid Services, does not tell you what you should charge for your G code. That is the responsibility of the provider to set your charges for your G code. As your services change, you may need to adjust your charges that you have previously set for your G codes and make any adjustments to that rate if appropriate. You are going to determine what your normal charges are for those services as you're setting what the overall charge will be for your G codes. And then it is going to be the sum of normal charges, which is going to be your charge for that payment G code. And you are going to report that charge in the total charge field on your FQHC claim. Charges must be the same for all your patients. What this means is that you cannot, by Medicare rules and regulations, charge a different charge for patients depending on perhaps, this person is a Medicare patient, so this is the charge we're going to charge for them. This person is a self-pay, so we are going to charge this charge for them. Your charges must be uniform and the same for all patients. So when you are setting up your claim, you need to report a billable encounter. And what that means is you are going to have a billable encounter revenue code, as we've been talking about. Again, the 52X is for a medical, the 900 is for a mental health encounter. You will include the appropriate payment code in the HCPCS field. So your appropriate G code in the HCPCS field of your claim. Again, these are your payment codes or your FQHC G codes. They will all be reported with 1 unit and your payment code charge. Another line should represent your qualifying visit. You are going to report the qualifying visit with the same billable encounter revenue code that you reported with your G code. You will report the appropriate qualifying visit HCPCS code in the HCPCS code field. 1 unit of service, you need to report your charges. I've been talking about qualifying visits. I think this would be a really good time to show you where you can find what is considered to be a qualifying visit. So if you go out to CMS's website, you will type in cms.gov and then select Medicare, select providers and suppliers, and then to the left, you can see various different providers and suppliers, and we want to look at federally qualified health centers. This will take you directly to the CMS webpage designed specifically for FQHCs. That is the long way to get to it. You can certainly also use the little search bar and simply type in federally qualified health centers, and it will take you there quicker. But once you get to the FQHC center page, if I scroll down, you will see a lot of really valuable information for FQHCs. What I'm looking for as I roll down is the FQHC PPS specific payment codes. I've been referring to them as qualifying visits, and it does mean the exact same thing. So when I click on this link, you will get a lot of really great information for FQHCs. I highly encourage you to save this document. It is set as a PDF. You can save this document, or you can go out to CMS's website and look at it when you need to. But in the beginning of this document, there's a lot of great information, some of those that I've already covered today. But what I am looking for as I scroll down are the specific payment codes. We have our G codes that we've talked about, but right below the G codes is the qualifying visits. So what you will see on this page is based on the FQHC G code. So if it's a G0466 for a new patient, these are all of the codes that would qualify for you to receive the FQHC PPS payment. Okay, if I continue to scroll down, the G0466 continues to the next page. We finally get to the G0467, which is for an established patient. And you can see the qualifying visit codes here. And as I mentioned earlier, typically the qualifying visits, more likely than not, are evaluation and management services. There are some preventative services that are considered to be qualifying visits, home visits for an established patient, transitional care management services, advanced care planning. We have some G codes for some of the preventative services that qualify for a FQHC PPS payment. We then have the codes for the IPPE, or the annual wellness visit. And then we get to the G0469 and G0470 codes, and these are the only qualifying visits for the mental health services. So I wanted to just take a moment to show you what we're talking about when I'm referring to qualifying visits and how you will receive a payment as a federally qualified health center. If you are reporting a code that is not a qualifying visit, or if perhaps you forget to report that second line for a qualifying visit and you only have the G code on your claim will reject in the fiscal intermediary standard system, which is the claims processing system, as a billing error. So take note of that. And then let's continue on to the next slide, which talks about subsequent claim lines. Now, the subsequent claim lines are going to be your incident to services. Now, as I mentioned earlier, these incident to services do not always generate a separate payment. There are a few that do. Recently, what came out is vaccines, preventative vaccines, such as the pneumococcal, the COVID-19, the influenza. and the hepatitis B vaccines, those do generate a separate payment beginning July 1st of 2025. However, most Incident to services do not generate a separate payment because the payment is already included in your FQHC G code. Once again, your Incident to services must be reported with the appropriate revenue code for the HCPCS code that is being billed. You want to include the appropriate CPT or HCPCS codes in the HCPCS code field. Once again, you are reporting 1 unit of service and charges. Charges are very important because even though these are Incident to services and you know that your payment for them is already included in your FQHC prospective payment system, you still must include charges in the charge field. And then finally, you will sum up all of your charges under revenue code 0001 with the total of all charges. And you want to ensure that you have calculated that appropriately. If there is a miscalculation, your claim could reject in our system for that charge line being incorrect. Okay, so let's go over some basic billing examples. The first example I have for you is an established patient who comes into your FQHC facility to receive a medical encounter. As you can see, at a minimum, you will have 2 lines on your claim. One line is your FQHC G code. So in this instance, it's G0467 because that is the G code for an established patient. You will see the service date, number of units is 1, and your total charges that you have set for G0467. You will have another line that will show your qualifying visit. And I have here for this example 99213, which is an evaluation and management service. This is a qualifying visit. We have, again, our service dates, our units, and total charges. And then, as I mentioned earlier, any Incident to services that occurred, you will want to include those on your claim under the appropriate revenue code. And then finally, you will total up your claim under revenue code 0001 with your charges calculated appropriately. This next example is for a mental health encounter. So once again, I'm using the appropriate revenue code for a mental health visit, which is 900. I have G0470, which is for an established patient receiving mental health services. I have my service dates and units, and the total charges is the set amount that the provider has established for G0470. And then on the next line, I have the psychiatric evaluation CPT code, which is 90791. This is a qualifying visit, and therefore on this claim, this FQHC would receive an FQHC PPS payment. Once again, total charges under revenue code 0001 that is calculated appropriately and adds up. So we talked a little bit earlier about multiple encounters on the same day, and I said that there are 2 exceptions to the rule for which you can receive 2 FQHC PPS payments on the same day. So just as a reminder, the first exception is a medical encounter and a mental health encounter that happens on the same day. In this instance, you would receive 2 FQHC PPS payments. The second exception is 2 medical visits that occur on the same day. So if a patient is seen in the morning and they see their physician, And then later that day, they suffer an additional illness or injury that requires for them to be seen again for additional diagnosis or treatment, then in this instance, you could receive 2 FQHC PPS payments on that day. Now, if a patient has a medical encounter on the same day as they had their IPPE or annual wellness visit, this does not generate 2 separate FQHC PPS payments. You would only receive 1 payment that day, regardless of the fact that the patient they saw 2 physicians or 2 core practitioners on the same day. In this instance, you would only receive 1 payment, and that would be the IPPE or the annual wellness visit. And the medical encounter would be reported on your claim in this instance as an incident to service, but only 1 payment would be generated in this instance. So let's look at how you would bill multiple encounters on the same day. So as I mentioned, patient has a medical and a mental health encounter on the same day. You would report the second encounter on additional claim lines. You would have your payment code line, which for the medical visit would again be your 521 revenue code with the appropriate G code. You would have your qualifying visit on the next line. You would then have your mental health 900 revenue code with the appropriate G code for mental health and the qualifying visit for that mental health visit. So in this instance, you would have at a minimum 4 lines on your claim. Okay? The same thing holds true if the patient has 2 medical encounters that qualify to receive 2 FQHC PPS payments. Once again, you're going to report the second encounter on additional claim lines. But this time you need to report a modifier 59 along with that second encounter. The modifier 59 tells our system that this is a separately identifiable medical encounter for which we as a provider have medical documentation that supports that Medicare should pay 2 encounters on the same day. You would report modifier 59. Once again, you would have the corresponding qualifying visit code for that second encounter as well. And here's what a claim example may look like for a medical and a mental health encounter that occurred on the same day. As I mentioned, I have a minimum of 4 lines on this claim. I have my G0467 that aligns with revenue code 521 for my established patient. I have the qualifying visit of 99213, also reported under revenue code 521. And then I have my mental health encounter under revenue code 900 with the appropriate G code of G0470 for an established patient, and revenue code 900 for my qualifying visit. And in this instance, it's a psychiatric evaluation under 90791. This is a claim example for an established patient who has 2 unrelated medical encounters. Again, at a minimum, you will have 4 lines. But as always, report any incident to services that also occurred. So for our first encounter, we have G0467 for our established patient under revenue code 521. We have our qualifying visit of 99214, also reported under 521. This patient had the removal of an impacted earwax. So we have the revenue code, which is not 521, but the appropriate revenue code for this incident to service, as well as the appropriate HCPCS or CPT code for that service. And then we're saying that the patient came back because they had an additional illness or injury that required additional diagnosis, and they were required to be seen again. So we have our second encounter. Once again, under Revenue Code 521, G0467 again, but this time we have modifier 59. Modifier 59 tells our system this is separately identifiable and I should receive 2 FQHC PPS payments, and I do have documentation that supports that. In addition, you also have the qualifying visit that goes along with that. Now, for illustration purposes, I did not include any additional incident 2 services for that second encounter, but of course, if there were any that occurred during that encounter, please also report those incident 2 services on your claim. With that, this concludes our basic billing in a federally qualified health center. I hope you have found this information valuable. We will be conducting additional YouTube videos for federally qualified health centers, and we look forward to seeing you again. Thank you so much and have a great rest of your day.